Thank you, Chair, and through you to members of committee. I'm happy to provide an overview of the report that you see before you. I think it's important to share, and apologies if we've not made it clear in the report, that this year's winter response, as you've received it, is not simply a transplant of last year's winter response. We have not brought you the same report that we used last year. It's not the same winter response, just in a different location. It's fundamentally different, and I think it's important that we draw that distinction. Namely, last year we relied heavily and benefited from the WISH coalition. This year there is no such coalition that exists. We've also brought forward to you in this report a three-pronged approach this year, recognizing the change in landscape and the need in our community. We're happy to provide the daytime drop-in space and overnight drop-in space as part of this year's proposed approach. As well, something that we have been working desperately to bring forward in any capacity, and we're happy to do so in this fashion, is a very much needed mental health and addictions stabilization space as part of our winter response as well. Of course, we will be benefiting from and using the assets we purchased last year in the overnight temporary emergency shelters by way of the trailers. But while the infrastructure is the same, the intent and the focus of this year's response is fundamentally different. You will see in the report that the location for one of the emergency shelters is the Fanshawe Golf Course. That is to target a more rapid housing approach. That site, very different than last year. Last year, the emphasis and our urgency was just to get people in a space and make sure they're safe. We feel we are still providing that level of acute care throughout this program. However, the Fanshawe site is more geared towards rapid housing, looking at using it as a temporary transitional housing site to really focus on individuals who can successfully move to permanent housing with supports through this intervention. The River Road location as proposed in the report before you is again a first for us as civic administration in partnership with our community partners to provide an Indigenous-led response this winter. Again, this is not something that we were able to provide or something we did not provide last year during the winter, which I feel is a fundamental difference this year compared to last, and also makes the location quite appropriate for this type of service, having received feedback from service providers and community partners. The city's role will also be different this year in that the response will be driven or has been driven by, and the programming will be reflective of the agencies that are involved and the expertise that they are bringing to the table. The locations of which the emergency overnight shelters will be provided, so the two city-owned assets, the golf courses, will not be transient or drop-in nature. These sites, again, are very specific for targeted reasons, but they will not be intended to be drop-in space. We've heard from the community, it's been well shared by the community that that type of drop-in space, the ability to connect and be safe is still needed, and it's still needed in the core. And that's why we're excited that in this report and this year, we're able to bring forward at minimum 100 beds, including no less than 40 overnight beds of a drop-in nature in the core area. Last year we had 60 beds. This year we've increased it to 100. So we feel like the balance between daytime space for people to receive services and get out of the cold in the core is still there. As well, we've added or maintained 40 beds in the core as well for people to connect in that area. We still see services being offered in the core for people to attend to. But additionally, this year, we are working with community partners to bring services on site to the overnight shelter locations. That has included conversations internally with our social service partners here at the city, but also externally with some of the health providers and some of the acute care providers that will be able to come on site. We'll work with the operators of the site to finalize what that looks like and what the need is once tenants are settled in. We think it's important as civic administration to make it clear that we are not moving or putting people in these overnight temporary locations. In fact, we are using our homeless system, the data that we have and the by name list, to match people to the most appropriate site, but then still offer them the choice. And it will be people choosing to attend to these sites that will get them there. Transportation to the sites will be the same as it was last year, in which we helped people move from Wellington Valley, for example, to some of our overnight sites, overnight locations. We'll be doing the same again this year. Once individuals are settled and moved into the overnight locations, we'll be working with the on-site service providers to help facilitate and best understand what transportation needs will truly exist. Some individuals may require it more frequently than others, and we're expecting that, and we are working through with the providers on what that transportation plan will look like. But as I noted, this is not expected to be a drop-in or transient in nature, so the amount of foot traffic to and from should be very minimal, if any. We feel that in mid-September, we were able to have some conversations around the planning table with some of the current shelter operators, as well as with members of the London Homeless Coalition, to best understand what the space capacity limits would be this winter. Through those conversations in September, we were able to best understand the need for the city to be involved in bringing this report forward in the first place. We have shared, and members of the London Homeless Coalition have seen this winter response report. And to date, we have not received any opposition to this plan from any member of the London Homeless Coalition to date. We hope that committee will take the opportunity to ask us questions about the three-pronged approach, and we're happy to take any questions that you might have. Thank you.
Okay, a discussion on the report and the recommendation from staff. Councillor Lewis, go ahead.
Thank you, Mr. Chair. I guess I will lead off, and I will try not to exceed my 5 minutes, but if I do, I might come back for a second round. First of all, I want to say to both our staff, but also to the agencies and the staff involved, those at ATLOSA, at Arcade, and others, that we appreciate all the work that has gone into this already. When I first saw this report, I had a little bit of a knee-jerk reaction that I'm not sure that I liked the direction we were going. And then I did some more reading and I gave it some more consideration and I did a little bit more research myself. And I think that this is a good plan. And I want to start by emphasizing what Mr. Dickens presented to us. The lion's share of the homeless prevention and the shelters and services for Londoners experiencing homelessness is going to continue to be in the downtown core. And I think that that's very important. We heard people will have a choice whether or not they utilize these sites. No one is being forced to go out to the golf course at the edge of the city and reside in one of these temporary home settings. It's going to be a choice. And certainly when it comes to the River Road location, this is going to be an Indigenous-led site for Londoners experiencing homelessness from the Indigenous community. And I am certainly not going to presume to know better than the Indigenous people leading this project, that I know better than they do as to how to help Indigenous Londoners experiencing homelessness. I think it's just wrong on so many levels for us to presume that Indigenous leadership at ATLOSA doesn't have the best outcomes in mind for the Indigenous homeless population. I think they absolutely do. And we've through this committee and through this council have had partnerships with Atlosa on a number of projects and initiatives, and they've all been very successful. And I'm very appreciative of the work that both they and I should say Noki Quay and Namarind as well have done with London's urban Indigenous population. So I very much support this, and I think that River Road provides them a space where there's an opportunity to do some culturally appropriate supports for those individuals as well. And the connection to the river and to be in a more remote location, I think will be a benefit. I also think it's important, and I'm gonna share a little bit personal here, and I'm gonna get a little bit perhaps emotional, but I hear a lot of folks who are academics or experts in the study of homelessness and homelessness prevention. And I appreciate the work they do, I really do. But to me, I feel like there's an overemphasis on the value of the connections they make through street-involved culture, street-involved community. Human beings did not evolve to be solitary creatures, and any connection is important. But that doesn't mean that they're all healthy. You know, last night, many members of this council attended the launch of the Shine the Light campaign to end women abuse, and we heard from this year's Survivor speaker about how someone hitting you is not love, how someone emotionally abusing you is not love. Well, you know what else isn't love? Someone enabling and feeding your addiction, or enabling and feeding a cycle of poverty. And sometimes that's what those street connections do. They keep someone in a cycle where they can't break their situation in terms of poverty and homelessness. Most of you know that I give part of my life and time as a foster parent with at-risk youth. You know, with Children's Aid, we talk about how very valuable and important it is to maintain healthy connections with biological family members as much as possible. And those can be very positive things. They can also be very toxic things. And sometimes, for a youth at risk, the best thing for them is to break from those connections and get a fresh start. Sometimes that even means moving to another community to do that. And I see the parallels here with people who may be trying to break the cycle of homelessness. The opportunity to go to a location that is not easy to get to, where there's no nice way to say this, so I'm just going to say it, where their dealer or maybe their pimp or someone else who is keeping them in a cycle of exploitation, which we know some homeless people face. When it's not easy for those people to get to them, they have a better chance of breaking that cycle and getting out of poverty and getting out of homelessness and stabilizing and moving on to new chapters and better chapters in their lives. So I don't discount that there can sometimes be very valuable connections that people experiencing homelessness make on the street with people who are sharing that experience. Yes, there can be, but there can also be very toxic ones. You know, we heard Mr. Dickens say that it's going to be a choice to go out here and that we're not moving, we're just not forcing people out of the city. We're not. But what we are doing, and you know, Chuck Lazenby from the Unity Project said this in a Free Press article, we're taking a little bit of a different approach where it's not a one-size-fits-all approach. And I think that that's a good thing, because the homeless population in our community or in any community, they're not a homogeneous group. One size doesn't fit all. The 65 beds that will be available at these two golf course locations are only 65 beds. And no, they won't be the right fit for quite a number of people experiencing homelessness. But for 65 people, they might be. And they might be a chance at a fresh start on things. And I understand the community concerns. And I appreciate that Mr. Dickens was able to articulate that there will be security on site, that there will be fencing to create a community apart from the community that may already be there. But I think this is worth a try. And I'm encouraged by the work that everybody has put into this so far. And I will continue to appreciate the work that the staff at the Men's Mission and the Salvation Army and the Arcade locations downtown are doing as well. But I think that this is worth a try. And I haven't heard anything yet that makes me feel otherwise. So I'll end there. I'll continue to listen to the debate.